As I mentioned, there will be a recording of the webinar and slides available on our website after the presentation. It should be up there within the next week or so. But I wanted to thank you for joining us today. We're going to talk a little bit about understanding healthcare reform and open enrollment. And again, I am Stephanie Fahuri, the supervising attorney with the Cancer Legal Resource Center. So probably all of you already are aware of this, but the Cancer Legal Resource Center is a program of the Disability Rights Legal Center, and our goal is to provide information and resources to people who have cancer-related legal issues. So that includes patients, survivors, caregivers, healthcare professionals, and pretty much anyone coping with cancer. All of our services are confidential, and we also have our services available in both English and Spanish, and we also utilize a language line for callers who have who speak languages other than English and Spanish. And we do focus on an education model, which means that for the most part, we try to provide information about the laws that might apply to someone's situation and potentially provide them with information that will help them advocate for themselves, as opposed to doing direct litigation and direct representation of clients. Now, I will do my best to try to answer questions that you may have during the webinar. I'm going to save those questions for the end. But if questions do come up that I'm not able to answer today, or if you have questions that come up later, or friends or family or colleagues have other questions, please feel free to contact us at our National Telephone Assistance Line. The phone number is 866-843-2572. And we also have an online intake form at CLRCintake.org. And sometimes it can be a little bit easier to get through using the online intake form just because of our call volumes. Now, today I'm planning on giving an overview of a few different things. So first, I want to talk a bit about the consumer protections put into place by the Affordable Care Act. Because it is open enrollment and some people might be looking to purchase new insurance plans and maybe haven't had to think about buying new insurance, I want to make sure that we're all on the same page understanding what some of these newer insurance policies actually do have to cover and some of the rules that they have to comply with. And then I'm going to talk a little bit about getting health coverage, what some of the options might be, and then I'll go into a little more detail about open enrollment in the health insurance exchanges and the type of information that you might have to provide or update depending on whether or not you've already got insurance and that sort of thing. So without further ado, I do want to go over some of those consumer protections that are in place as a result of the ACA. And so many of these consumer protections have been in effect for quite some time, and some of them, have been rolled out a little bit more incrementally during the last 5 years. The law was passed in 2010, so I guess it's been, over 5 years now. So let's move forward here, and first let's talk about which policies actually have to comply with the new rules under the Affordable Care Act. So most group and individual plans do have to comply with a lot of these new rules that I'm going to talk about. But the law does apply differently or might not apply at all if you are on TRICARE, Medicare or Medicaid. It might not apply to flexible spending accounts or health savings accounts and Indian tribal governments. So, for the most part, we're going to be talking about group and individual health plans when we're talking about the Affordable Care Act. So the other thing to keep in mind is that some of these rules don't apply to grandfathered plans. And a grandfathered plan is a health insurance policy or plan that was issued prior to 3/23/2010, so March 23rd, 2010. And so those policies are considered grandfathered unless there have been substantial changes to the plan that have taken place. Policies issued on or after March 23rd, 2010 do have to comply with all of these new rules. And so it's important to think about what type of plan you have or know what type of plan you have. And actually, insurance companies are required to let you know if your insurance policy is still considered grandfathered. And so, if you're looking to purchase a new insurance policy during this open enrollment period, your new policy will not be considered grandfathered because obviously it's a newer policy. The one thing where it gets a little bit confusing is if, let's say you've just started a new job and you've just signed up for your new job's health insurance plan, whether or not the policy is grandfathered it doesn't matter when you've joined it. It's going to matter when the policy actually came into existence and whether there have been people on it. So you might have just started a new job in 2015, but if your employer has been using the same health insurance policy since 2008, then potentially you've just joined a grandfathered plan. So if you're not clear on that, you can certainly ask your employer or your HR, whoever's in charge of health insurance at your place of employment, but they are required to tell you whether or not your plan is grandfathered. So, before the Affordable Care Act was passed, there were lifetime and annual limits that were often in place on people's policies. So, there were limits on benefits paid out over the course of the year or over the entire course of the policy. And sometimes that could be as low as maybe $50,000 in a year or maybe $1 million over the course of a policy. And while $1 million certainly sounds like a lot of money, or $50,000, if you're healthy, sounds like, oh, okay, that seems like, quite a bit of coverage. Once you get sick or, as going through cancer treatment, you can go through $50,000 worth of coverage in one doctor's visit or one hospital stay. So this would essentially leave people uninsured once they'd reached that limit, despite the fact that they had been paying their health insurance premiums. So now that the Affordable Care Act has been more fully implemented, there are no longer lifetime limits allowed on essential health benefits. So essential health benefits are things like emergency care, hospitalization, prescription drugs, ambulatory care, sort of all of the main things that we sort of think about when we're thinking about what should be covered by health insurance. And this does apply to all plans, so regardless of whether you have a grandfathered plan or a newer plan, there should not be lifetime limits imposed on the amount of benefits that can be paid out. Now, for annual limits, this was sort of more transitional. When the law was passed in 2010, it sort of upped the annual limits for several years. But as of January 1st, 2014, there are now no annual caps or limits allowed on essential health benefits either. So, if that's something that you had been concerned about, no need to worry, there are no longer annual limits allowed on essential health benefits. And this does apply to group grandfathered plans, but it doesn't apply to individual grandfathered plans. So if you had purchased an individual policy directly from an insurance company back before the law was passed, and they're still trying to impose annual limits on you, they might be allowed to do that. But if you're concerned about those annual limits, the good news is that because we're in open enrollment right now, you can purchase a new individual plan and then you won't have to worry about annual limits ever again because you'd be purchasing a non-grandfathered plan. Now, another big concern before the Affordable Care Act was rescissions, or basically canceling people's health insurance retroactively. This was pretty common for insurance companies to go back through people's applications and find any mistakes or omissions, whether they were intentional or not. And then they would essentially retroactively cancel the person's individual policy after they got sick, which would, again, basically leave them uninsured. The ACA now prohibits any insurer from rescinding someone's plan unless they fail to pay premiums. So that makes sense. Obviously, you have to keep paying for your health insurance, and if you don't, they can cancel it. Or if you commit fraud or make an intentional misrepresentation on your application for coverage. So some examples of fraud or an intentional misrepresentation of material fact could include something like claiming a non-spouse as a spouse, or claiming an ineligible individual as an eligible dependent, or something that we've heard a little bit about is maybe using someone else's address to try to get lower health insurance premiums. Because one thing that I'll talk a little bit more about later is they can ask where you live, and a lot of times health insurance premiums are based somewhat on where you live and your geographical rating area. Generally, if you live in an urban area, your health insurance costs are higher than if you live in a rural area. So if you decide, well, I heard that my brother who lives out in the country pays a lot less for his health insurance, so I'm just going to use his address as my address. Unfortunately, that is potentially fraud because you're straight up lying intentionally on your application. And if they find that out, they can potentially cancel your insurance policy for making that intentional misrepresentation. Now, a really big part of the Affordable Care Act was trying to improve not only access to insurance and making it more affordable, but also trying to improve access to preventive services. So one of the changes that the Affordable Care Act has done for newer plans, so not grandfathered plans, is that there's now a big long list of certain preventive services that if you go to an in-network provider to access those services, they are now covered with no deductibles and no co-payments. And this applies to Medicare as well. Medicare also now covers a bunch of preventive services with no co-payments and no deductible. So that doesn't mean that if you have a grandfathered plan that you won't be able to get these preventive services. It just means that if you have a newer plan, you might not have to pay that $20 copay to go in for your annual wellness visit, or you might not have to pay, whatever the co-insurance or co-payment would be for cervical cancer screening or something like that. If you have an older plan, you can obviously still access the preventive services. You might just have to meet your deductible and pay the co-payments. And Healthcare.gov actually has a pretty long list. They have the list of all of the preventive care services that are now covered with no copayment and no deductible. A couple of the cancer-related ones are colorectal cancer screening if you're over age 50, HPV immunization, tobacco use counseling, BRCA, genetic counseling, mammograms every 1 to 2 years for women over 40, like I said, cervical cancer screening. So if you're curious about what the other preventive services are that should now be covered with no copayment and no deductible, you can go to healthcare.gov. And the one thing that I also want to make clear about this is that it does only apply to services that are coded as preventive. If you've already been diagnosed with cancer, let's say you've had colorectal cancer in the past, but now you're several years in remission, or it was removed during surgery or whatever, and then you need to go in for another colonoscopy. Unfortunately, that would no longer be considered preventive because you've already been diagnosed with that in the past. At that point, it's considered diagnostic, so you would potentially have to pay a copayment or meet your deductible. So whether or not it's considered preventive is partially going to depend on your own medical history. A really big thing that the ACA did for children and young adults is that it now allows children and young adults to be covered under their parents' health insurance plan until age 26. So previously, a lot of times young adults had to either be full-time students, or maybe the plan would only cover them up until age 21 or 22, or they had to be considered a dependent for IRS tax purposes. None of that is true any longer. You don't have to be claimed as a dependent. The young adult can be married as long as he or she is under 26. And at this point, the young adult can even be employed and have insurance offered through his or her employer. But if it makes sense for that young adult to stay on the parents' health insurance plan, they can still do that up to age 26. And then once they reach age 26, they're eligible for something called a special enrollment period, which I'll talk a little bit more about later, so that they can purchase new health insurance. Now, I would say that the biggest change that we've seen here at the CLRC with respect to the Affordable Care Act is the fact that as of January 1st, 2014, insurers can no longer consider pre-existing conditions when determining whether or not to cover someone with a health insurance policy, and they also can't take it into account when they're deciding how much to charge that person. So, many people called us during the years before January 1st, 2014, saying, okay, I lost my job, I can't afford COBRA, I'm not eligible for Medicaid in my state, what are my options to get health insurance? And usually the answer had to be, I'm sorry, there aren't any options. Or, in the years between when the law was passed and January 1st, 2014, there were these pre-existing condition insurance plans, but those weren't necessarily the best option for people either. Now, it's been almost 2 years, and I think it's been a really huge change and really great for people who are cancer survivors or currently going through treatment. And now you can purchase insurance without having to worry about, are they going to charge me a lot, or are they going to completely deny me because of my pre-existing condition? They can't even ask about it. They can't ask about your health status. They can't ask about medical history, genetic information, and they can't even ask about your gender, which is pretty interesting because before the ACA, women were generally charged quite a bit more for insurance than men were. So now they can't even discriminate based on gender. Now, the ACA has also made some changes with respect to insurance appeals. And so for plans and policies beginning July 1st, 2011, insurance policies or the insurance company does have to notify the beneficiary of the reason for denial, and they have to notify you about what your rights are to appeal their denial. They have to respond to an appeal within 72 hours for an urgent request, within 30 days for a non-urgent request, and within 60 days for a denial of payment for services already received. So the good news is that, the goal was to make the insurance appeals process a little bit more transparent so that you wouldn't have to, go back to your policy, try to read the fine print to figure out how exactly to appeal the denial. Now they're supposed to notify you of that when they tell you why they're denying coverage. And, this hasn't changed anything for certain states. Many states already had internal appeals processes required, or, the response times, they might have already had laws that specifically said how quickly that people had to, the insurance policies or the insurance plans had to respond. So the other big change is with respect to external appeal rights. And again, some states already had external appeals available for people who were not satisfied with the decisions that their insurance companies made. And just to make sure that we're all sort of on the same page here, if you do get denied coverage by your insurance company for something that you think is covered, usually the first step is to do an internal appeal. So that's where you are appealing directly to the insurance company, and then they come back and say, oh, we made a mistake, or no, we still think we made the right choice. And in some states, that was sort of where it ended. There weren't any external appeals that were mandated. Now, as of January 1st, 2012, every state has to have some sort of external appeal process available. So that means that you are able, once you've gone through the internal appeals process, you can go to an independent external review body and request for them to take a look at, your claim, and they get to make a decision. Okay, yes, the insurance company made the right choice, or no, they didn't. You usually have at least 60 days to request the external appeal and respond. Some states provide a longer timeline than that. And, like I said, some states already had an external appeals process in place. California had something called IMR, Independent Medical Review. And with these external appeals, you're essentially going to an outside body who is not affiliated with the insurance company. So hopefully they are independent and can make an unbiased decision based on the medical evidence that's being provided to them. Now, really quickly, I do want to mention a couple of changes to Medicare that have taken place as a result of the Affordable Care Act. I already mentioned free preventive services. There's actually now a free annual wellness visit that's also provided for Medicare beneficiaries. And, previously when you would sign up for Medicare, maybe you would go to a doctor when you initially signed up, but then you wouldn't go again until you got sick. And so now with these annual wellness visits, again, they're trying to focus a little bit more on preventive care. There's also something called a medical loss ratio. So for Medicare Advantage plans, which is basically like Medicare HMOs or Medicare PPOs, for Medicare Advantage plans, there's now something called an 85% medical loss ratio, which essentially means that they have to spend at least 85% of the money that they're bringing in on actual health services. So they can't be spending more than 15% of the money they're bringing in on, administration or profit or whatever. It actually has to be spent on healthcare services. And then there are also some other cost controls that have been implemented to try to help keep Part B premiums lower. Now, when we're talking about Medicare, another really important thing that we get questions about is prescription drugs. And one of the things that the Affordable Care Act has done is it's aiming to close the donut hole, or at least reduce it quite a bit, by 2020. So this is obviously pretty gradual, but the donut hole, in case you're not familiar, is basically where once you're on Medicare Part D and you're getting your prescription drugs, once you and your plan have reached a certain amount of spending on prescription drugs, you enter something called the coverage gap, or the donut hole. And that's where you have to pay a really significant percentage of your prescription drug costs until you reach another level of out-of-pocket spending, and then that's when Medicare kicks back in. So the donut hole will be reduced from 100% to 25% by 2020. So right now it's 2015. If you're in the coverage gap, and you're getting brand name drugs, you're paying 45% of the cost of those, or 65% for generic drugs. Next year, it'll remain the same for brand name drugs, but it goes down for generic drugs to 58%. Now, we also get a lot of questions about clinical trials, and as a result of the Affordable Care Act, health insurance companies now have to cover the routine costs of care associated with clinical trials, and they cannot discriminate against you for participating. Now, so this says no preemption for more protective state laws, and I just want to clarify what exactly that means. So usually when we are talking about a federal law versus a state law, the federal law is usually the law of the land, and state law has to comply, but federal law usually is, the one that sort of rules. With respect to clinical trials, if there are more protective state laws in place, those are the ones that are looked to. So for example, California already had a law about cancer clinical trials for state regulated plans and for Medicaid, and so those laws still are in place, but in other states where there weren't protections for people who were enrolled in clinical trials, now they have that option as well under the ACA. And when we're talking about routine costs of care, I just want to give an example. What's not covered is the investigational treatment, device, or service. So let's say you have breast cancer or had breast cancer, and you enroll in a clinical trial to try out some sort of new drug. And the trial is saying, okay, we want you to have 6 mammograms throughout the next year just to see how this drug is affecting you. Now, if your insurance company was already going to cover 1 mammogram per year because of whatever your doctor had recommended, or because of whatever would be medically necessary for you, your insurance company would still have to cover that 1 mammogram because that would be a routine cost associated with the clinical trial, but they wouldn't have to pay for the other 5. So items or services solely for satisfying data collection and analysis needs, those ones would not be covered by your insurance policy, but routine costs would be. And again, this unfortunately only applies to non-grandfathered plans. So if you have an older health insurance policy, then you might be out of luck unless your state has a state law that provides additional protections for people with who are enrolled in clinical trials. Okay, so now that we understand what some of the newer rules are that the insurance plans have to comply with, we're going to talk a little bit about actually getting health coverage. And so you might be wondering, okay, well, why do I have to get health coverage? Obviously, part of that is to reduce any out-of-pocket expenses that you might have should you have to start receiving any sort of treatment. But I'm not just sharing this information because I think it's fun and interesting, although I certainly do think it's fun and interesting. The ACA did include something called the individual mandate, and the individual mandate requires most U.S. citizens and legal residents to have health coverage. So there are some exceptions to the mandate. So for example, a break in coverage of less than 3 months would not be penalized. And there's also some other exceptions written into the law for religious objections and financial hardship. If someone would have to pay more than 8% of their household income to cover their premiums, they would potentially be exempt. Certain Native Americans or undocumented immigrants and people who are incarcerated are also exempt from the law. But if you don't meet one of those, if you're not part of one of those groups that's exempt, and you have a break in coverage of more than 3 months, you might have to pay a penalty. And a lot of people sort of learned this the hard way when they filed their income taxes earlier this year, because they did not have coverage for the year 2014. So for 2015, if you are not currently insured and you've been uninsured for more than 3 months, the penalty is $350 per adult, per uninsured adult, or 2% of your income, whichever is higher. So I think some people ran into the issue for 2014 where they heard, oh, I heard it's only a $95 penalty. So I'll just pay the $95 penalty and see how that goes. But unfortunately, for 2014, it was $95 or 1% of your income, whichever is higher. So, the most likely 2% of your income is going to be higher than $350. So it's probably in your best interest to get health coverage as opposed to waiting around to just pay a penalty. And the penalties are going to continue to go up. For 2016, if you don't have health coverage, it's going to go up to $695 per adult, or 2.5% of your income, whichever is higher. And then it's not clear what exactly it will be for 2017 and beyond, but the goal is that the penalty cannot exceed the national average for a bronze plan, which I'll talk a little bit more about later. But, whether or not you want to take that risk to pay the penalty is certainly up to you, but it seems like if you're going to be spending that much money, you might as well purchase health insurance coverage, especially considering how expensive healthcare costs are if you did get sick. Now, there are certain types of coverage that count for the individual mandate, and that does include Medicaid. So having Medicaid coverage does comply with the individual mandate, and for people under a certain income level, complying with the individual mandate is somewhat easy because they might qualify for Medicaid. They won't have to worry about paying health insurance premiums and shopping around for plans. This sort of makes it pretty simple for certain people under a certain income level to get coverage. So I want to talk a little bit about Medicaid expansion because there have been some changes with respect to the Medicaid programs in various states as a result of the Affordable Care Act, which impacts people's ability to actually get health coverage. So when the ACA was passed, the goal was to have everyone under a certain income level eligible for Medicaid in every single state. And the federal government was going to cover the costs of all of these newly eligible people for the first 5 years. And so this newly eligible group would be people earning less than 133% of the federal poverty level. And it says with a 5% income disregard, so that essentially means 138% of the federal poverty level. So in 2015, 133% of the federal poverty level for an individual is around $16,000. For family of 4, around $32,000 per year. And, this was a pretty big change because previously just about every state's Medicaid program not only required you to have low income, but it also required you to have low assets. So you couldn't have more than $2,000 in the bank, or you couldn't own more than one car or one house. And in addition to having low income and low assets, you also had to potentially be a part of one of these other categories, such as aged, blind, or disabled, or pregnant, or have dependent children with one of the parents missing from your household. There are a bunch of different ways to qualify for Medicaid, but it wasn't just a program for low-income people. It was a program for people who had low income, low assets, and then also were part of one of these categories of eligible people. With this expansion, that eliminated the idea, of course, let me start over. So with the expansion, those categories still exist, but now there are newly eligible people. So if you're not pregnant or you're not disabled or you're not over 65, if you don't meet one of those, if you're not part of one of those categories, you might be eligible for Medicaid just based on your income. So that was the goal. Unfortunately, when the Supreme Court had to make some decisions about the Affordable Care Act back in 2011, the one thing that it did limit was Medicaid expansion. So, as I said, the federal government was planning on paying for these newly eligible people for the first 5 years, and it was basically requiring the states to expand their Medicaid programs and accept this money. The Supreme Court said, no, the states have to voluntarily agree to accept more funding for expansion. And what that essentially means is that in several states, 19 actually right now, they have decided not to expand Medicaid. And so that's made it pretty difficult for a lot of people in those states to access affordable health coverage. So in case you're curious, right now 31 states, including DC, have adopted Medicaid expansion. So that means in those 31 states, anyone who makes under 138-ish% of the federal poverty line is potentially eligible for Medicaid. Right now, there's one state that's still sort of discussing whether or not to expand Medicaid, and that's Utah. And then there are 19 states that have not adopted Medicaid expansion at this time. And those states include Alabama, Florida, Georgia, Idaho, Kansas, Louisiana, Maine, Mississippi, Missouri, Nebraska, North Carolina, Oklahoma, South Carolina, South Dakota, Tennessee, Texas, Virginia, Wisconsin, and Wyoming. So if you live in one of those states, or if any of your family members live in one of those states, unfortunately, if you earn less than 138% of the federal poverty line and you don't meet one of those other categorical eligibility criteria, you are potentially out of luck with respect to Medicaid. Now, one thing that I do want to remind people about is the fact that you can actually enroll in Medicaid at any time. So, we're talking about open enrollment because we're currently in the open enrollment period for private insurance, but Medicaid doesn't have set enrollment periods. You can sign up at any time whenever you become eligible, so you won't have to wait for the same open enrollment periods that you would have to if you were purchasing a private policy through the health insurance exchange. So if you think that your income might be low enough and you live in a state that's expanded Medicaid, or if your income and assets are low enough and you meet one of those other requirements, you can basically sign up now and potentially be covered much sooner than if you are trying to buy private insurance. Your coverage wouldn't begin until January 1st. So just as a FYI, you can enroll in Medicaid at any time. You don't have to worry about special enrollment periods or open enrollment periods. So if you're looking to purchase a new policy or change your policy, one thing that you might be concerned about is insurance affordability. And so I already mentioned that when they're setting premium rates, they cannot take into account your medical history or whether or not you have a pre-existing condition. And so these are the things that insurance companies can take into account. So they can look and see, okay, are you buying this plan for yourself or is it for you and your family members? They can take into account your age, and not to the same extent that they used to be able to. Now the ratio is only 3 times, which means that they can only charge the oldest people on their plans up to 3 times the amount that they were charging the youngest people. previously they could basically use whatever ratio they wanted. So if they wanted to charge a 60-year-old person, 8 times what they were charging a 25-year-old person, they certainly could do that if it made sense. Now they can only charge up to 3 times the amount. As I mentioned before, they can take into account your rating area, your geographic location. And then depending on what state you live in, they also can potentially take into account tobacco use. So it varies. Different states have different ways of treating tobacco use. Insurers can charge tobacco users up to 50% more than those who don't use tobacco, but that's not the case in every state. So if that's something that you're concerned about or wondering about, you can check with your state's Department of Insurance. Now, the Affordable Care Act again, had some pretty lofty goals about creating health insurance marketplaces in every state. Not every state has done that. So many states have been relying on Healthcare.gov to be their health insurance marketplace for people in their state. And so one way to purchase a private health insurance policy is through either this federal or state health insurance exchanges. The states that have their own exchanges currently are California, Colorado, Connecticut, DC, Idaho, Kentucky, Maryland, Massachusetts, Minnesota, New York, Rhode Island, Vermont, and Washington. There had been a couple of other health insurance marketplaces put in place by a couple other states that have since, I believe, shut down. So now, those states are using healthcare.gov. So if you live in any of the states that I mentioned, you can still go to healthcare.gov and it'll redirect you to the insurance marketplace for your state. But if you don't live in one of those states, then potentially you'll be purchasing your insurance through healthcare.gov. Now, I also want to make it clear before we move on to open enrollment and give you a little bit more information about the open enrollment process. I do want you to know that there might be other times throughout the year that you can sign up for health coverage. Just like with Medicaid not having any sort of set enrollment period, there are things called special enrollment periods that might allow you to sign up for coverage outside of open enrollment. So, for private insurance, they do want to prevent people from just waiting to sign up until they get sick, because otherwise, if everyone who signs up for insurance are the sick people, then health insurance costs are going to go up substantially. They obviously want to be covering people who are paying their monthly premiums and maybe not going to the doctor every single month. But there are special enrollment periods that allow people to sign up when some sort of major life event has taken place. And so these are some examples of some of those qualifying life events. So if you lose your insurance, so if you are working and you leave your job or you lose your job, that's a situation where traditionally you would have become eligible for COBRA, so you could stay on your health insurance from your employer, assuming that you could pay the premiums yourself. And so for a lot of people, COBRA is extremely expensive and maybe completely unaffordable. Now, in addition to becoming eligible for COBRA, you also now have the option to sign up for new health coverage as a result of losing your insurance. That puts you into a special enrollment period. Also, if your income changes substantially and maybe you no longer are eligible for Medicaid, that would put you eligible for a special enrollment period so you could purchase insurance through your health insurance marketplace. Also, if you move to a new state, or even if you move throughout your state, especially in a place like California or Texas or some of these larger states where the health insurance options vary depending on what county you live in, that would also potentially make you eligible for a special enrollment period. Same thing with getting married or divorced. As I mentioned earlier, turning 26, so you're aging out of your parents' policy. So if any of these things happen, you don't have to say, oh gosh, well, I lost my job in March, but open enrollment isn't until November 1st. What am I going to do in the meantime? No, you don't have to wait till open enrollment. You could potentially purchase a new policy at that time. So, unfortunately, if you failed to sign up for health insurance coverage before, and if you don't qualify for a special enrollment period, you do have to wait for open enrollment each year to sign up for a new plan. So in that situation I just mentioned, if you lose your job in March, and let's say you can't afford COBRA, you decide not to opt into COBRA, and your 60-day special enrollment period comes and goes, and you don't sign up for new coverage, and you're not eligible for Medicaid, at that point, you've basically wasted what your potential options would be, and at that point, you would have to wait until open enrollment to sign up for a new policy. So open enrollment is also the time of year that you're able to make changes to your insurance plan or switch your plan if you're not satisfied with the one that you currently have. So open enrollment for coverage beginning on January 1st, 2016, began on November 1st, so we're about halfway through the first month of open enrollment. Now, and it continues until January 31st. In previous years, open enrollment has lasted longer in an effort to try to get as many people as possible to sign up. And also this past year, it was extended quite a bit because a lot of people didn't realize that they were going to be penalized for not having insurance. And so if they waited until after January 31st to start their taxes, they only became notified about the penalty once they started doing their taxes and had already missed open enrollment for the following year. So hopefully that will not be the case for this upcoming year. If you're looking to change your plan or buy a new plan, try to do it before January 31st because there's no guarantee that they'll extend open enrollment again. So now that it's open enrollment, you might be wondering what your options are if you decide to purchase insurance through the health insurance marketplace. So in addition to having to comply with all of the rules that I mentioned earlier, all plans offered through the exchanges must cover essential health benefits. And these are the different options when you go into the exchange. So it's called the metal tiers because they're, different types of metal. So your options range from bronze to platinum. I'm not even going to talk about catastrophic plans because for most people they make no sense. They really are only in case of catastrophes and really don't cover much. And they're only available for people age 30 and under. So, we're looking at bronze through platinum. Bronze plans cover 60% of your healthcare costs and you pay 40%. Obviously, those bronze plans are probably going to have much lower premiums than some of these other options. So, there's silver, covers 70%, you pay 30%. Gold plan covers 80%, you pay 20% of your costs. Platinum obviously covers the most, which means that your premiums are probably also going to be the highest if you get a platinum plan. But, the flip side of that is maybe you might not have quite so many out-of-pocket costs. So what type of plan is best for you is really going to depend on your financial situation, maybe your health situation, but these are the options that are available on all of the exchanges. So why would you want to purchase through your health insurance marketplace? Well, that's the only way to get tax credits or premium subsidies that will help reduce the cost of your monthly health insurance premiums. So it is called the Affordable Care Act. Obviously, it wouldn't necessarily be fair to all of a sudden require everybody to have some sort of health coverage and not make that coverage more affordable for people. So if you make under 400% of the federal poverty line, which for 2015 is around $47,000 a year for an individual or around $95,000 for a family of four, you are potentially eligible for tax credits that would lower your monthly premiums. And so the way that tax credits usually work is, you do your taxes, you put in what your income is, you do your deductions, you do your credits, all at the same time when you're doing your taxes at the very end of the year, or hopefully, not April 15th, but some people like to procrastinate. That makes it a little bit more exciting doing your taxes at the last minute. But that's not how these tax credits work. So the way that these tax credits work is that you put in what you are expecting to earn over the course of the next year, so your expected income. And then based on your expected income, the health insurance marketplace comes up with a figure that they determine to be your tax credit. And then they prorate it throughout the next 12 months so that it lowers your monthly premiums throughout the year. Instead of, you have to pay all of this money out of pocket and then you get a credit at the end. They want it to be affordable throughout the whole year, so you're not just getting a big check at the end. Now, it is obviously difficult for a lot of people to estimate what their income is going to be. Obviously, some people have a salary and that's maybe easier, but if you are working hourly and you don't know exactly how many hours you're going to work over the next year, or if you're working part-time, or if you might be in and out of the workforce depending on your health status, it can make it a bit of a challenge to estimate. So it's important to keep the health insurance marketplace updated if there are any changes, and I'll talk a little bit more about that in a second. But essentially, the important thing to keep in mind is that if your income is under 400% of the federal poverty limit, you might be eligible for these subsidies. Unfortunately, if you are offered employer-sponsored health insurance, if your employer does offer insurance, you are not going to be eligible for these tax credits. And same thing if you're eligible for Medicare or Medicaid. So the good news is that in the states that have not expanded Medicaid, these tax credits actually are available for people between 100% and 400% of the federal poverty line. So if you're, pretty low income but not eligible for Medicaid in your state because it has an expanded Medicaid, you might still be eligible to purchase insurance through your health insurance exchange and get some pretty significant tax credits. Unfortunately, if you're in a state that has expanded Medicaid, then the cutoff is 138% of the federal poverty line, because if you're below that, then you're eligible for Medicaid, and you don't get to pick or choose which one you get. You're either eligible for Medicaid or you're eligible for the tax credits. So this table uses 2015 federal poverty limit figures, but I still thought it was useful to show the general ranges where you might qualify for lower out-of-pocket costs in addition to lower monthly premiums. So, depending on your income, if it's quite low, you might qualify for lower premiums and lower out-of-pocket costs for marketplace insurance. And that includes things like co-payments or out-of-pocket maximums. Now, one important thing that I do want to flag is that if you qualify for these extra the savings for the out-of-pocket costs, you only get them if you enroll in a plan in the silver category. So you can use that if you don't have, the super low income, you can get the tax credit for any of the metal categories, bronze, silver, gold, platinum. But if you want to get these cost-sharing reductions, you can only get them if you pick a silver plan. So if that's a little confusing, Healthcare.gov and the state exchanges do have phone numbers that you can call to actually talk to an enrollment counselor over the phone, and they can maybe explain it while you're going through the process. But that's something that you can certainly tackle once you're looking to purchase your new plan. So many people have already enrolled in coverage, last year or the year before. So if you signed up for coverage in 2015, now is the time during open enrollment where you can renew or change your plan for next year. Now, as I mentioned, we do strongly recommend that you update your expected income and household information for 2016, even if you plan to keep your current insurance. It's the only way to be sure that your premium tax credit and other savings for 2016 are accurate. And you also might find that there are new plans offered that might have a better price or might cover different things that'll be better for you. So if you don't act by December 15th, you'll probably be automatically re-enrolled for January 1st, but your premium tax credit will be based on last year's information. So it's a good idea if you already have coverage, just go into your account, double check that the information is accurate. You might need to recertify some information. And sometimes, if the health insurance company decides to no longer offer the plan that you're currently on, they might enroll you in a different plan if you don't go in and make the choice yourself. So again, it's really important to just keep this information updated, be aware of what is available to you. And like I said, you have to report changes to the information you provided if there have been changes. So if your income has changed, it's going to affect your premium tax credit. If the members of your household have changed, that also might affect your tax credit. Again, permanent address, that might affect what types of plans are available to you. And if you've recently become eligible for Medicare, or if you're eligible for Medicaid or something, that's something that you'll also need to update them with, because if you're eligible for Medicare, you cannot get premium tax credits and you can't purchase insurance through the exchange. Now, I do also want to clarify that buying insurance through Healthcare.gov or your state's health insurance marketplace, that's not the only option. But if you're looking to get these tax credits because your income makes you eligible for them, that's the only way to get the tax credits. If you earn more than 400% of the federal poverty line and you don't care about the credits, then it might not make sense for you to purchase through the health insurance exchange. Maybe you're not interested in those plans. You can contact the insurance company directly or contact an insurance agent or broker or some other online health insurance seller and purchase insurance that way. That's certainly still an option. That has not gone away, but you still would have to be doing that during open enrollment unless you're eligible for a special enrollment period. So just to sort of finish up here, I know that we're just about out of time. But just to put the pieces together, if you're looking to purchase a new insurance plan or you might need to switch, your income is going to have a lot to do with what you're potentially eligible for. If you live in a state that has expanded Medicaid and you earn less than 138% of the federal poverty line, you're most likely going to be eligible for Medicaid and that's what you'll be enrolled in. If you earn between 138 and 400% of the federal poverty line, you're potentially eligible for tax subsidies or tax credits. So it might make sense for you to purchase a plan through Healthcare.gov or your state's marketplace, and then you'll get those tax credits to reduce your monthly premiums. If you earn more than that, you can do basically whatever you want, but the health exchange will place people into either Medicaid or a private plan, depending on what your income is. Okay, so, now that we've gotten through all of that, I'm happy to stick around and try to answer maybe one or two questions if there are any questions. I'm going to go ahead and end the recording now.